which means warm greetings in my mother tongue Tamil. So before I go to my topic, there's a dishwasher picture and a microscope picture. You may be wondering what's the relationship between the two pictures. It will be clear as I proceed on to my slide. So, how did I get this topic? This world of diagnostic pathology is expanding every day. There are new techniques, new methods, new inventions. But yet, the basic work in any pathology laboratory is the histopathology, that is tissue processing. And this tissue processing, important chemical is xylene. If you know about xylene or not, it is expensive and it's a dermatotoxic and neurotoxic, as well as it is an environmental pollutant. Then why is it still used? That was a question for me, like why is it still used? It has so many disadvantages. So I researched upon are there any alternatives for the xylene, and I came across many results like limonene reagents, isopropanol, vegetable oils, but one substitute catch my attention. It was dilute dishwashing liquid which was used instead of xylene. Dishwashing liquid? Are you kidding me? So I did a further research on this topic and I found out few studies gave positive results. Is this true? So I went to my department, I got their permission and I did a project in my college. So this was my plan. First I had a question. I formulated my objectives and the materials. I stained slides, assessed, and did my statistics and concluded my results. So my topic has two main objectives. First, I use the mic. Okay, so first I substituted xylene with the dilute dishwashing liquid and then I assessed both the methods. The materials and methods are same as any routine histopathology technique except for the xylene. I'm substituting with 1.7% of dilute dishwashing liquid. Why is this 1.7%? Well, it was arbitrary. I just chose it from previous studies. So this is how I prepared my new substitute for xylene. That is a commercially available dishwashing liquid in my country, and I took 25 ml of the available packet with 1500 ml of dilute water to prepare my new substitute. And this is the basics. Any conventional staining methods, you will first immerse it in xylene, followed by alcohol, and staining by hematoxylin and eosin, and followed again by alcohol and xylene. So, in my method, I removed the xylene and the alcohol process and substituted it with dishwashing liquid. But mind it, actually this is a temperature sensitive method. This is done at 90 degrees Celsius. And followed it by distilled water immersion and again the routine staining. So this is how it differs from the routine conventional method. As you can see, 5 steps are eliminated from the method, thereby reducing the time. So after all the staining, it was went to assessment. How did I assess it? It was a single blinded assessment. That is, I knew which were the slides, but my pathologist who reviewed the slides didn't know which is the routine method and which is the new method. And she was made to score it on 5 main parameters, which is the nuclear staining, cytoplasmic staining, clarity, and any absence of artifacts and blurredness. And the maximum score any slide can get is about 11. So my results are, as you can see from the mean scores, the routine conventional method still stood its chance. It's about 1.2 points higher than my new method. And if I split up my score into intervals of 3, yet again the old method was better than the new method. As you can see, nearly 64% of the conventional method was in the excellent score range between 9 to 11. And when I split up into the components of staining, First, based on the adequacy of nuclear staining, it was found out that 97% of the conventional method had adequate staining, but only 89% of the new method has adequate, but it's fine. 89% of the slides had adequate staining. Similarly, for cytoplasmic staining, 97% in the old method and 93% in the new method. And regarding the clarity, again, 95% in the old and 90% in the new. So these are some of the pictures. As you can see, the xylene-free method had a more crispier staining of the cellular outlines. And this is, as you can see, there is higher contrast in the old method when compared to the xylene-free method. And this is a slide showing how it is inferior to the old method. The outline of the glands are not properly delineated in the new method. And actually both the pictures might be the same, but they are done by two different methods. This is to show how it can replace or maybe adequate for staining. This is a special statistical procedure to compare two methods, and what it gave was 54% of the comparisons, the older method outdated the new method, and in 23 comparisons both were equal, and in 23 comparisons the newer method was better than the old method. So what was my inference? So since the maximal attainable score was 11, I took 6 to be the average score for diagnosis. Nearly 81% of the new method was above the score of 6, and by Wilcoxon test, 54% of the sections was poorer than the conventional method, and by seeing the graphs, more than 90% of the sections in the new staining showed adequate nuclear, cytoplasmic, and clarity of staining. So my conclusions were, definitely it is not equal to the old method, but at the same time it is adequate for diagnosis, and when taken into the consideration of cost, time, and eco-friendliness, it certainly has its advantages. So my implications are, the foremost is the cost. As you can see, 9 liters of xylene costs around 63.9 euros, whereas the xylene-free method, that's the dishwashing liquid, just costs 0.28 euros. And regarding the time, since we are eliminating 5 steps, you spend just only 15 to 20 minutes. And toxicity is absolutely nil in the dishwashing liquid. So there are some limitations. For example, I have not assessed the longevity of the stain, whether it retains its characteristics, and I have not tested in other types of stainings. And this is a temperature sensitive method. You need an incubator to keep it at 90 degrees Celsius. So, thank you all.
Thank you. Are there questions from the audience? We showed the cost differences. It was much cheaper by using the free method, but you compare, you have to give 9 liters.
Because the commercially available liquid dishwashing soap in my country comes in 25 ml. So when we use the entire 25 ml to attain 1.7% concentration, it comes into 9 liters. So that's why I took it as 9 liters.
Yes, but the hematoxylin is only 500 ml you use.
Yeah, like maybe we can, if 9 liters cost 69 euros, we can derive it for 500 ml.
And well, you showed also it was 54%, it was not so good as, and then it was 46% better or as good as. But I mean, 46% versus 54 is not statistically significant, I think.
Yeah, it's not significant. Yeah.
Okay, questions? No? Well, thank you very much. Then we go on to the, was there somebody? Oh.
I would like to know that you said that it's adequate enough for diagnosis, but it's obviously not replacing hematoxylin.
Yeah.
So why should you use it? Like,
For example, in my country, we have certain limitations of resources. So in those times, it can be used as an alternative.
But again, we're not sure that whether you are diagnosing in a correct way. So even if you are spending that much money,
Okay.
which is cheaper comparing with hematoxylin and yosin, but still you are not sure that whether I'm diagnosing it properly or not. So then you are wasting those money as well. So do you think it will be okay to do
I
so?
think it can be used as a screening test maybe. Like for example, in peripheral centers where you don't have adequate facilities or when your resources are limited, it can definitely be used as at least a screening test. A dishwashing liquid is not very difficult to get, right? We use it in our home. Any more questions?
Thank you. Then we proceed with the
Yeah, thank you so much.